practitioner or APRN, and I joined Queens just a couple of months ago. I've been a nurse practitioner for 21 years, and most of that time has been spent in allergy and pulmonary, and recently have joined the ENT division here at Queens West. So today we're going to talk about nasal allergies, and I chose this topic because it's so very common. We see nasal allergies across the lifespan in children and in adults. And for some, it can be just mild symptoms, but for many, it can really be cause a lot of symptoms and sometimes make you even miserable. So we'll talk about causes of nasal allergies, and we'll talk about diagnosis and treatment and symptoms. And nasal allergies are often referred to as hay fever or as allergic rhinitis as well. And the one thing about nasal allergies is that they can really have a big impact on your life, on your sleep, on your work. For kids, they can have impact on school or on attention or learning or even behavior sometimes. So let's talk a little bit about the causes of nasal allergies. Well, often they just run in families. You can have an inherited tendency or susceptibility to develop allergic reactions or allergy symptoms. So many people just come by it honestly. But in addition, the environment that you grow up in matters too. So more allergies are seen in developed countries or cleaner countries. And the thought is that if your immune system isn't kept busy fighting off bacteria and viruses, that it's going to keep itself busy mounting defenses against harmless substances like grass pollen, for example. But if your immune system's kind of more toughened up from maybe growing up on a farm or from growing up in a big family, or even growing up in a developing country, if your immune system's more toughened up, you often see less allergies. So often it's a combination of genetics as well as the environment that you grow up in that impact whether or not you'll have allergies. So when we think about allergens like pollen or dust mite debris or animal dander, they enter our nasal tissue, and often sneezing can occur, our nose can run, our eyes can water, and that's part of the body's initial immune defense to remove those pollens. But that's not all that our immune system does. It does a whole lot more than that. Allergies are basically an overreactive or hyperactive immune system. If you're susceptible to allergies, your immune system will incorrectly identify a harmless allergen like grass pollen as a health threat. Because our immune systems, they're meant to protect us, again, from those harmful bacteria or viruses that can cause disease. But with the allergies, your body reacts as if these harmless substances can do you harm. So how does this happen? We use grass pollen as an example. The grass pollen enters the nasal tissue and in your nose, and if you're susceptible, your immune system will produce a substance or a protein. It's an antibody that's called IgE. Now that's not to be confused with Governor Ige. This is pronounced IgE, and it's an antibody that we all produce. So it's reacting as though it's dangerous, and the immune system wants to remember if it comes into contact with this dangerous grass pollen again. And so that IgE attaches itself to a mast cell, and that mast cell is a white blood cell that's located in parts of your body that have close contact with the outside environment. The outside environment would those areas would be things like your skin, your nasal tissue, your lungs. And it does that because it wants to remember if you come in contact with grass pollen again. So it's kind of primed and ready to recognize that grass pollen IgE allergy. And so at the bottom of this slide, you see your mast cell. with the green Y-shaped IgE antibodies attached to it. Along comes grass pollen, and the IgE antibodies attach to that grass pollen, and it's like a lock and key. And so what happens is that activates your mast cell to release these inflammatory chemicals like histamine, like leukotrienes, prostaglandin. And that's the result. What the result of that is the allergy symptoms that we all can see and feel if you are someone who's unfortunate enough to have miserable allergy symptoms. And what are those symptoms that release of those chemical or inflammatory mediators produce? Well, it can be a lot of things. Our sinus linings can get swollen. It can cause fluid to get trapped in our sinuses, leading to sinus infections. Our eustachian tube, which is this tube that leads from the middle ear to the back of the throat, can get inflamed and swollen and can cause muffled hearing, ear congestion or fullness, or even ear infections. And of course, our eyes and nose can get inflamed, stuffy nose, itchy eyes, itchy throat. And then our asthma can also flare and become symptomatic, all related to allergies. Let's talk a little bit about seasonal versus year-round allergies. These are the main culprits for the allergy symptoms that we experience. So here's our friend in the middle of a pretty wicked grass pollen season here, lots of pollen floating through the air. He's pretty miserable, the red nose, sneezing, and the culprit for these seasonal allergies is tree pollen, grass pollen, and weed pollen. These things float through the air. Pollen is light and it's dry, and it can float for hundreds of miles. So it's not necessarily about the pollen that you have from the grass in your front yard. It's about our entire town or our entire island. It's about the grass pollen that's from hundreds of miles away that can impact your symptoms. A lot of times we think it's flowers. Whoops, sorry about that. We think it's flowers that will cause us to have seasonal allergies, and that can be true. If you're someone who works very closely with flowers, if you're pollinating flowers yourself, if you are working in a nursery and you have lots of close work with flowers, you can be impacted, but generally pollen from flowers is very heavy. It's not as light as tree and grass and weed pollen, so it doesn't travel and float through the air like those things do. Next, we'll talk about year-round allergies, also called perennial allergies. These things can be a tricky or, cause issues because a lot of these are located in our homes and where we spend so much of our time. So dog is a big culprit for year-round allergies, or cat, or any other furry animals that you might have in your home, guinea pigs, ferrets. In addition, cockroach. And there's never just one cockroach, so it's usually multiple cockroaches. We can inhale the debris and the excrement, and it can be a real issue for us if we are allergic to cockroaches. Mold spores as well can cause year-round allergies. And there's never just one mold spore, same concept. If you've got a water leak, and trust me on this because I've been through this recently, those mold spores can rapidly multiply and cause a lot of symptoms if you happen to be allergic to mold. And then dust mites, and the same concept. There's never just one dust mite. Dust mites are tiny little microscopic creatures. They live in our beds and our pillows. They live in our blankets and even stuffed animals. And all of these year-round allergies can be a big issue if you're allergic to them and you're inhaling these all the time that you are at home, especially in your bedroom. And so we'll talk about some avoidance measures for these year-round allergens. Here I have a calendar, just a yearly calendar here, kind of breaking those seasonal and perennial or year-round allergens up a little bit. In many areas, especially on the mainland, tree pollen, couple months in early spring, grass pollen, a couple months in later spring or early summer, weed pollen, a couple months, usually in the summer or fall. In our abundant vegetation here in Hawaii, our pollens can be year-round. And so what often is a seasonal allergies in other areas can be a year-round allergen for us, on top of the year-round or perennial allergies that already exist: dust mites, mold, animal dander. And because of our humid climate, dust mites thrive, mold thrives. So these levels can be pretty abundant. And if you are someone who has even one of these allergies, even just dust mite or mold or a pollen, that can cause significant symptoms. But when you start having multiple allergies, maybe you're allergic to dust mite and mold and dog and grass pollen and weed pollen and tree pollen, you can really, you can have a whole lot of symptoms. So how do we diagnose allergies? Sometimes it's easy, you know. Every time I visit my auntie who has a cat, my eyes water, my nose runs. That can be pretty easy to diagnose. You know, I think I'm allergic to the cat. But sometimes it's harder. Maybe you have symptoms all year and you're just not really sure what the cause of it is. Your symptoms mean more than any test, and that's always, you know, often the case. The test is there to support that diagnosis. Your symptoms and your history mean more than anything. But this is when allergy testing, I think, can be helpful to try to untangle, to see what are your triggers here. Let's understand your triggers so that we can direct the treatment to those triggers. So I have here some pictures of allergy skin testing. This device here, that's just a single skin test device. This one is a multi-test device. So this one you could test for 10 things at once. This one would just be one test at a time. The multi-test can be good for adults, but I think especially good for kids when you can just do one press on the skin and get 10 tests done at one time. And the way these work is the end of the testing device is a little bit jagged, and the allergen testing extract is held there, and then it gets pressed on the skin. Now, it's called a skin test or a scratch test or a prick test because it disturbs the top layer of your skin. And remember what's in your skin, those mast cells, right? They're conveniently located there. And so they start to perk up and remember, hey, wait a minute, I produced some IgE antibodies to grass pollen, and now you've pricked the skin with this jagged little device here, and it can cause a mast cell reaction. It's just a little hive, though. It's a small hive. It can be itchy, and so what it looks like is just this red. That signifies an allergic reaction. It's a bump with some surrounding redness. You can do allergy skin tests on the arm or on the back. These are some examples on the back with lots of positives. So lots of itchy, the itchiness it fades away. It doesn't last. You place the tests, and usually you read the tests in about 20 minutes or so, and then the hives will just fade away. Skin testing is a great option for allergy testing. You get results immediately, that same day as your visit. It's a very valid test, gives you good information. I think the cons of skin testing are that you've got to stop some medicines. So you've got to stop antihistamines, which makes sense because it's the histamine reaction that you're looking for. So we want to stop antihistamines before the testing. And then if you have really sensitive skin, lots of eczema or psoriasis, and your skin's sensitive, skin testing might not be the best choice for you. Next, let's talk a little bit about, and that's just demonstrating it's that histamine release that we're looking for our skin testing. Let's talk about blood allergy testing, another really good option for allergy testing. With blood allergy testing, you can test for one allergen. So for example, that grass pollen or cat pollen, or cat dander, or you can test for multiple allergies. You can do a panel with just one blood draw. It's specific IgE that the blood test is looking for. And so it's another good option. It's especially a good option if you, for whatever reason, you just can't stop your antihistamines or some other medicines before, like you would have to for a skin test. And again, it's that IgE, those antibodies that a blood test is looking for. There are other allergy testing that's available. I would just, say caution with other allergy testing. There's things that you can order online, some allergy testing you could do at home. A lot of those are not IgE based, and so sometimes they can be inaccurate. Sometimes they can falsely diagnose allergy, or they can sometimes miss true, genuine allergy, which, it's just, they're not as accurate as the skin testing or blood testing that I've described. And a lot of them can sometimes have a lot of foods on there as well. And for nasal allergies, it's not usually foods that drive those symptoms. So I hate to see someone who, maybe unnecessarily restricts or removes things from their diet that they might not need to. So I generally recommend just the skin testing or the blood testing that we talked about. Let's shift gears a little bit and talk about treating nasal allergies. We can't cure nasal allergies, but there's three main ways that we treat, and of course it's dependent upon your symptoms, but we avoid, avoidance of the things that we're allergic to, medicines, and then immunotherapy. And immunotherapy consists of allergy drops, or there's allergy tablets as well, or allergy shots. Let's go back to our friend here in the middle of pollen season with all that pollen surrounding him. Sometimes avoidance, especially with seasonal allergies, can be almost impossible and really difficult because remember, the pollen is light and dry and it's floating through the air. It gets pretty tough to avoid that. There's some things that we can do to reduce our exposure. Avoid sitting in tall grass. Avoid mowing the lawn, avoid touching your eyes and your nose after you've been around grass, or if you've even been outside, washing your hands when you come in, showering. The pollen can stick to your hair, so making sure you wash your hair as well to remove those pollens from you. Now, when we think about year-round allergens, again, I'm going to focus on the bedroom because you might not need to make changes in your whole house, but this right here is a pretty allergy-friendly bedroom. Now let's compare that to maybe something like this with lots of allergens. So what are the things that we can do if we have allergies to hopefully avoid some of these things to prevent symptoms? Well, if we're pollen allergic, we can make sure we keep our windows shut. And that would be in your car as well. Keeping the windows shut can be helpful. And in the bedroom, it can make a nice difference because we would be inhaling those pollens through an open window all night. So let's keep the windows in our bedroom shut. If we're allergic to pets, we want to keep them out of the bedroom and definitely off of the bed and keep the door closed. If we're allergic to mold and we've got a water leak, we want to take care of that water leak so that the mold is gone. And if we like potted plants, which I do, but they can be definitely, they can have mold in the soil and in in that pot. And so we want to get rid of any potted plants from the bedroom. If we're dust mite allergic, we can encase the mattress and the box spring and the pillows in allergen-proof or dust mite-proof covers. And remember, dust mites, they love a humid environment, so I don't always like to add extra humidity to the bedroom because if you're dust mite allergic, because they'll just thrive. For little ones who like to sleep with a stuffed animal, there's dust mites in there. You know, the dust mites love fabric. That's where they live. So we want to think about removing the stuffed animals from the bed if we can. If we can't, you can wash them. If you can't wash them or dry them, then you can put them in a nice Ziploc bag and freeze them overnight or for about a day, and then let them thaw out. That will kill the dust mites. And if we're cockroach allergic, obviously we want to take care of those cockroaches. And then that leaves us back with our nice allergy-friendly bedroom. So next we're going to talk about medicines. And so when I think of allergy medicines and the role of allergy medicines, I like to think of a barn full of animals with an open barn door. It takes a whole lot of effort to get those animals back in the barn if they get out. And that same concept goes for our allergy symptoms. It takes a lot of effort to get your symptoms controlled, your allergy symptoms controlled once they get flared up or your symptoms are out of the barn. If we can just keep that door shut, it's a lot less effort. It takes a lot less medicine. Allergy medicines help keep that barn door shut on our allergy symptoms. So we can use meds or medications to help keep that barn door shut. If you live with a pet that you're allergic to, we can help keep that door shut by taking medicine every day to prevent symptoms. If you have mild allergies, it might take a few medicines to keep that door shut on your allergy symptoms. Often it might take more than one medicine. So let's talk a little bit about what those medicines are. Antihistamines are our most common. They're convenient, they're available over the counter, they work well for runny and itchy nose. A lot of people reach for Benadryl, and it can work well for allergy symptoms, but the downsides are it only lasts for about 4 to 6 hours, and then there's some side effects with it, dry mouth, sedating, or make you sleepy. I usually recommend the longer lasting over-the-counter products like loratadine or Claritin, cetirizine or Zyrtec, fexofenadine or Allegra, or levocetirizine, which is Zysol. These are well tolerated, little side effects, little if any sedation, and they just last a lot longer. Some other medicines that we can use to treat our nasal allergies, a nasal steroid spray. These are also available over the counter, multiple choices. These are some brand names that you might see: Flonase, Nasacort, Rhinocort. A prescription nasal spray would be Azolastine, which is it blocks the histamine release right in the nasal tissue. Compared to the nasal steroid sprays, they kind of dial down your immune response a little bit. They treat that inflammation in your nose, which is often seen as nasal congestion. Leukotriene blockers, like Singulair, or the generic name of that is Montelukast. So these are good choices, especially if you have, this is a good choice, especially if you have asthma. Remember, leukotrienes are one of those inflammatory chemicals that gets released from your mast cell. And so if we can block those, it can be helpful to treat your symptoms. Sometimes people will want to reach for honey to treat your pollen allergies. And I haven't seen a lot of evidence on that, but I can tell you just anecdotally, I had a patient several years ago who she treated herself with honey, and it worked well for her. And then she got a batch that I think must have had a lot more pollen in it, and she ended up having an anaphylactic reaction to that pollen. So I would just say, be cautious, and anything that you do, maybe just use a tiny little bit, because it's not an approved medicine for allergy treatment. So finally, we'll talk about allergy shots and kind of how do they work. They basically teach your immune system that the grass pollen or other pollens or dust mite or pet dander or that they're not dangerous. They desensitize your immune system so that you can tolerate these things that you're allergic to. So who's a good candidate for allergy shots? I think if you've had a poor response to medicines, if they've just not worked for you, or maybe you've had some side effects from medicines, if you have asthma as well, or if you've had complications from your allergies, like lots of ear infections or lots of sinus infections, allergy shots can be an option. And the process of allergy shots is you start with a teeny tiny little dose. It's a deliberate, controlled exposure by gradually increasing the dose of what you're allergic to. And this takes time. It's like climbing stairs, and you can't skip steps. You've got to take one stair at a time, increasing that dose very slowly until you get to a therapeutic dose. And then that's considered your maintenance dose, which you can then get every 2 to 4 weeks. Generally, the time frame for allergy shots is about 3 to 5 years. And the whole goal is that while early, when your dose is tiny with the allergy shot, and you might have a lot of symptoms, over time, as your dose builds, your symptoms obviously decrease. And the nice thing is that your symptom resolution can last for several years after your allergy shots are complete. There's also another option, allergy drops or tablets. These are nice because they don't require the same number of visits as allergy shots do. Often you can maybe take your first dose in the office and then the remainder at home. You place those drops or tablets under your tongue, and they can be used sometimes just seasonally for things like grass or ragweed, or year-round for things like dust mite. So finally, when do you see a specialist for your allergies? I think if your quality of life is impaired, if your work or school or activities or hobbies or sleep are impacted because you're just so congested or have so many symptoms and you're not getting relief from over-the-counter medicines or even prescription medicines, we might need to talk about some other treatment options. Or if you've had complications from your allergies, lots of sinus or ear infections, if your hearing's impacted, or if your asthma's continually flared from your allergies, I think that's a good point to see a specialist. So mahalo, thank you so much for joining me to talk about this today, and let me see if we have questions. And I would also encourage anyone to reach out to me after this as well. So bear with me as I read these questions here.
Thank you, Beth, for the presentation. I can read the question so everyone can hear it. So the first question is, does having year-round dry nasal mucus and somewhat obstruct breathing could be caused by the allergy? Using, I think it is called fluconase spray, helps with that symptoms.
Yeah, that sure sounds like it could be related to allergy symptoms. The nasal mucus, maybe some nasal congestion. I think that's what you mean by your breathing is obstructed. It certainly could be caused by allergy symptoms. The fluticasone is a good choice. The brand name of that is Flonase. It's a common over-the-counter nasal spray. It's a steroid nasal spray, so its job is to really work on the inflammation in your nose to help alleviate or lessen those symptoms. Okay.
Okay, next question is, why would Allegra D 12-hour be more effective than Allegra D 24-hour pills for me?
That's a good question. So, the antihistamines like Allegra, Claritin, Zyrtec, um, they all say that they last 24 hours, but you don't get quite 24 hours of relief with them. And so I wonder if you're experiencing improved symptom relief by giving yourself dosing twice a day, because you're getting more coverage throughout the day than if you would by using the 24-hour version. You're just getting more coverage throughout the day. So I think that's fine to do that.
Okay. And then is there something that can be done so I do not need to always use the nasal spray? Would an allergy test be a good option to find what actually caused the allergic reaction?
Yeah, the medicines are sometimes needed. Like I said, sometimes we need multiple medicines, but I totally understand and get that it can be not easy to take a medicine every day, or even if it's an over-the-counter nasal spray, there's still a burden that goes along with taking a daily medicine. And so this is when if we did some testing and we could understand what was behind your symptoms, that if you understand your allergies and understand what's causing the symptoms, sometimes you can end up using less medicine. And so, yes, I think an allergy test would be a good option for you.
Okay, another question. Why do some allergies develop as an adult? For example, mock orange flowers developed much later in life.
Oh, yeah. So you can develop allergies at any point in your life. That's the tricky thing about allergies. Usually you do they show themselves in childhood, but you can develop allergies at any point. When sometimes the allergies show themselves um, later in life if we've moved. So, for example, if you've made a move across states, or from Hawaii to the mainland, or from the mainland to here, when you move to a new area, sometimes you have a honeymoon period. So you can go through about 3 years where um, you're developing new sensitivities, new allergies, and you move somewhere and you think, hey, I've lost my allergies. I'm not allergic anymore. Well, sometimes it's just that you're getting used to the allergies that are the new allergens you've not been exposed to in the past, and then they hit you. So you can unfortunately develop them at any point in your life.
Okay, we have one more question. Is there anything I can do to prevent my sinus from getting infected?
Yeah, that's a good question. I think, physically removing the allergens with sinus rinses can be very helpful. So what you're doing is you're removing them from your body and from your nasal passageways. So sinus rinse is a good place to start.
Okay, do we have any more questions?
Yeah, I
Okay,
see
why do
this one.
allergy symptoms, I'm sorry, we have one more. Why do allergy symptoms seem to appear more in the later afternoon or early evening?
Yeah, the pollen counts can fluctuate throughout the day. So you know, you just maybe the pollen counts are often higher early in the morning, or later in the evening, and so you're probably just catching it during higher times of day.
Okay, great. Okay, and I also, if anybody would like a copy of this presentation, they can email me and I'll put my address here. See, can you
Mhm.
see it? Okay, can you folks see the? We'll be starting our poll shortly at this time that I request if all of you could please complete. Are you folks able to, can you see my screen?
Just as you're sharing, you're starting to share content.
Okay, sorry. Okay, Sorry, having some technical difficulties here. Thank you for everyone's patience.
Now it's the take on poll.
Okay. So I have to go back to here. This is so confusing. Polling. Okay, I shall be starting the poll soon. And it should only take you about 2 minutes to complete. If I can have everyone's participation, that'll be very great. Do you see it now?
Yeah.
Okay.
You just click right there on the screen.
Yeah.
Oh.
Cole has about 5 questions on there, so it should be really quick. Thank you. Oh, how come you guys are seeing that? Okay. You finished, Mac?
No.
Okay, I'm going to close the poll at this time. Again, the West Oahu Virtual Speaking of Health series is the third Thursday of each month, same time, 12:30 to 1:30. Tune in for the next lecture. Will be coming to you on Thursday, July 15, and our speaker will be our pediatric, adult orthopedic, and sports medicine specialist, Dr. Megan Kuba, who'll be talking about growing up without growing pains. So look for that announcement shortly. On behalf of our COO and Senior VP, Susan Murray, and our Chief Medical Officer, Dr. Ronald Kuroda, and the entire Queens Medical Center West Oahu Ohana, mahalo nui loa. Thank you very much for joining us today. Until next time, please take care and always be safe. Thank you.
Thank you.
It didn't come out good on my screen. The sharing part, it didn't. Not supposed to show. That's supposed to show the whole thing. Yeah.
Oh, not just a
Okay,
panel?
yeah.
Okay.
Did it go? Everything good?
Yeah, I mean.
Yeah, that was a good presentation. There was someone that requested a list of antihistamines. I have her I can get her address and I'll email it to you if you could email it to her.
Yeah.
Yeah, and then if anybody, I can actually go back in there and see if there's anybody that requested. But I have lunch for you.
Oh, perfect. That's
Wait,
perfect.
how can you carry all of that? You know what? Let me get you a bag.
Thank you. That's very nice.
You can keep this too. See, I heard you're having issues with your phone.
Oh my goodness.
I heard
It's
about
been-
yeah.
It's been, yeah. I just keep saying it could be worse. It could be
It
worse.
could be worse.
Yes.
I mean,
It could absolutely be worse. Thank you. That's very kind. I
yeah,
appreciate
thank
that.
you. Welcome to Queens West.
Oh, that's so nice. Thank you.
Okay, thank you very much. And then I'll let you know, Beth, if I receive any emails requesting
Sure.
for more information, and then I'll forward them to you.
Okay.
Okay, thank you very much. Yeah, it looks very. I'll try not to put it. Thank you. I messed up. I messed up on the sharing, I guess.
Oh, no.
Oh, you can see the, yeah, but then
Was
you,
it supposed to look like that?
no, you took the poll, right?
Yeah.
But
It
then,
was just on the right side of my
oh,
feet, a little panel.
but the flyer is supposed to be
The
Um,
flyer was
like
on
the-
the left side, but it was really small.
yeah, so to have been like the whole page.
Oh.
I don't know how come it came out like that. Haven't learned this with this WebEx.
Mm.